Herniated discs is something that bother an awful lot of people, and commonly when we're talking about the lower back, which is what I'm discussing in this video, they're going to affect this bottom section down here, the 4-5 and the 5S1. These are the discs that generally take most of the body weight. The 5S1 a little bit more so than the 4-5, and it's something that patients come in all the time struggling with something going on in that area. Now, with regards to actually getting some right stretches for this area, I'll go through a few bits and pieces that you can do at home, but ultimately, you know, discs can be a little bit more complicated, and actually going and seeing someone, either if you're in London, seeing someone like us, or outside of London, someone like us, would be really, really helpful. Someone who does the same sort of things that we do, because it works. And unfortunately, we see a lot of patients that have seen tons of other practitioners, tons of other more or less sophisticated approaches, and what we do, it really does help these sorts of patients. So the things you can do at home: number one, the disc is a lower bone structure and it's failed. So if you think of your ankle's a lower bone structure. If you sprain the ligaments in your ankle, you don't go hopping around on them. Normally we strap it up, maybe use a crutch for a few days or a week just to take pressure off that ankle, and then off we go. Problem with your back is you're up and about doing things every day, and for practical reasons we can't really brace this area very well to protect it. And furthermore, if we do, then you run to overtly brace it with things like supports, etc. Then you run the risk of reducing muscle mass, which then creates other challenges which you don't want. So we have to do the right sort of things at home to support this structure. Now, the spine itself, and again, a lot of the patients that we see have imaging, so we really start to understand and see the patterns with patients that have these sorts of disc herniations or disc problems. It tends to be that there's a flatness to the spine. The curve is reduced, so they're day in, day out loading more on these discs, and that's when they get really stubborn, don't heal them very well. So the first thing we want to do is avoid the necessity to bend forwards. So getting these hips moving a little bit better is really, really helpful. So doing particular stretches at home, the glutes, the hamstrings, the hip flexors, to ease some of the tension so that hip moves better, so the lower back doesn't have to. Classic one for patients when we come here, when we get them to have a look at their range of motion, when they bend forwards, it's all back, no hips, especially in guys. Guys are really, really prone to this. So make sure, number one, that you're getting your hips stretched out and they're working nicely without stretching your back. Bending forwards to touch your toes is a very bad way of helping this problem, because you're being very lazy with your technique. You need to stretch through the hip only and not involving the back. So there's other ways to do that, and we talk about this on the YouTube channel. There's other videos of ours on how to stretch your hamstrings, your glutes, etc. And it's all done, all of our videos are done with your back in mind. So check those out. Next thing, a nice stretch for the discs and the lower back. Sometimes this is a bit more difficult for you to do, but it's really, really good. Essentially, you get a rolled up towel, place it underneath the lower back here, and that just takes pressure off those discs. It's very different to backward bending. Backward bending can often be painful, and we find patients in the clinic here where they do backward bending and it hurts, but they do this at home and it feels nice. It's a different movement, different mechanics. So do give it a go, 2 to 3, 4 minutes, and then roll off safely. Again, we've got a video on this lumbar disc stretch on our channel. Check it out, and it goes through exactly how to do that, so that'll be a really useful one for you. Ultimately, these sorts of disc problems do need help, and coming into the clinic, having treatment here will be helpful. You know, check out the website, it goes through a lot of detail on what we do, but one of the main ones that really, really helps these sorts of disc issues is actually spinal decompression or IDD therapy. And with that, we're directly taking pressure off these discs, allowing them to get that respite that they need and go through that natural healing process. Now, there's other bits that go alongside that, some of the other therapies that we combine, and that makes up sort of our unique approach. And you can read much more about that on the website, or get in contact with us and we'll talk you through it, no problem. But that is the most effective way to take pressure off those discs in a non-surgical way. The important thing to note is that spinal decompression, you can have surgical spinal decompression where they do an operation and take bits away. We do not do that. IDD therapy or spinal decompression in the clinic essentially involves you standing up next to a table. It's really, really awesome. As the table lowers you down for you, we then strap you in, a nice gentle pulling, open up these discs and just create a little pumping effect down here, and then when the treatment's over, the table pops you back up again. It's lovely to have done, and much, much better than any other approach. So definitely recommend that if you are getting a more stubborn disc herniation. Try those things at home by all means. They're smarter approaches than the traditional hug your knees or bend forwards, because those exercises just make it worse. But if you're not getting any relief, book in, see someone who can really help you with more sophisticated treatment, and there is real hope get that herniated disc better so your body can return to normal activity without pain and really sort of live life properly. Hope you found this video helpful. Hit the comments in below if you've got any questions about how does it work, those sorts of things, or your own experiences, questions, and you can always reach out to us at the clinic by giving us a call or sending us an email or contacting us on here or the other social platforms. But remember to subscribe to make sure you stay up to date with these videos and useful bits of content that we put out on a daily or weekly basis. Thanks for watching.